Broadcasting live and in high definition for all North Texas. Fox 4 News starts now.
The mandatory quarantine of North Texas native Kaci Hickox is generating debate and raising concern among U.S. officials and healthcare workers. Good evening, everyone. I'm Natalie Solis. Hickox, a 2002 UT Arlington grad, is being held in New Jersey. The nurse just returned from a trip to Sierra Leone with Doctors Without Borders, where she worked with Ebola patients. She is the first traveler to be held under a state-mandated 21-day quarantine, even though she's already tested negative for Ebola. Zahid Arab joins us in studio now with the details behind the quarantine controversy. Zahid.
Well, Natalie, I spoke to Kaci's mom today. She says her daughter is frustrated and still trying to wrap her head around what's happening. She isn't ready to talk right now, but to other media, the nurse publicly slammed the government on how it's handling the situation. Some say it could discourage others from aiding the Ebola fight. The nurse quarantined at a Newark, New Jersey hospital after arriving from West Africa says she's living outside in a tent with no shower or flushable toilet, AC or heat. She calls her isolation, quote, inhumane. Kaci Hickox, a UT Arlington grad and nurse volunteering with Doctors Without Borders, told media her basic human rights are being violated.
The government's job is to protect the safety and health of our citizens.
New Jersey Governor Chris Christie says it was his decision to keep Hickox in isolation. She's the first nurse quarantined under a state mandate requiring all healthcare workers who had contact with Ebola patients in Africa to be quarantined for 21 days when they return to the U.S., even though tests on the nurse for Ebola are negative.
Kaci just put her life on the line to help those in need.
Dr. James Pinckney from Diamond Physicians says while quarantines are necessary for travelers showing Ebola symptoms, he says the conditions Kaci are in are not okay.
If we just start putting people in tents with no AC and a window and don't let them talk to anybody, no one's going to want to go to West Africa to help.
The new sanctions could impact aid from doctors and nurses.
People will not volunteer to go.
And church missionaries. David Williams is part of a group from the Louisville church that provides financial and medical help to villages in Sierra Leone. He hopes stricter sanctions for health workers doesn't evolve into an outright travel ban.
If people in other states had said, we're not going to Dallas because, they have Ebola in Dallas, it will harm our reputation, but more, it will harm our economy.
3 days in isolation, Hickox still has no signs of Ebola, not even a fever. But her anger is reaching a boiling point. In an interview, Hickox says health officials should be making policies related to Ebola, not politicians. Her lawyer is planning legal action to get her out of isolation, and a hearing is expected to happen by Tuesday.
All right, so Zahid, the doctor that you spoke to, as well as the missionary, they say that they don't think that a travel ban to West Africa for everyone will work. Any details on that?
Well, they really don't think that people are going to tell the truth. They say people are going to lie to avoid getting questioned, possibly isolated, which would obviously create the problem of people possibly being exposed to the virus, coming into this country, and not being treated, which would put their friends, family, and communities at risk. So, a lot of people are talking about this. A lot of, you got to trust the people coming into the country.
That's right. All right. Zahid, thank you so much. Appreciate it.